Are you wondering if you or someone you love has a heart defect? I'm Dr. Kavitha Chintala, Clinical Director, Senior Interventional Pediatric Cardiologist, Care Hospitals, Hyderabad. In this video, I will discuss 5 ways of how you can spot heart disease in your infant child. An infant is someone who is from birth to 1 year of age. So the 5 symptoms you should suspect that the child may have heart disease are: number 1, rapid breathing. Normally, an infant should breathe quietly and unlabored. But if the child is taking excessive breaths every minute, then you suspect that there's rapid breathing. You will also notice that the chest rises and falls very rapidly. You can also see some abdominal movement and the muscles going in and out. Sometimes you may also notice that the nasal flaring is there. That means there is excess labored breathing. So all these, especially when the child is feeding, should make you suspect that there may be a heart disease. Now the number 2 symptom is feeding difficulty. Again, infants normally can breastfeed very comfortably for 10 to 20 minutes on each side. And if you find that the baby has difficulty in feeding, which means the baby needs to take a breath, so the baby sucks a little, rests for a while and then sucks. So we call it a suck-rest cycle. So if you notice this and the baby is unable to take the entire feed like the baby was doing before, then there is feeding difficulty. Sometimes you will also notice that the baby is sweating over the forehead when the baby is feeding and also breathing very rapidly when the baby is feeding, because basically feeding is like exercise for these infants. So this is the second symptom that should make you suspect that there may be heart disease. The third way to suspect is when your baby is not gaining weight adequately. Normally, the baby has to gain weight every month since birth, and if the child is falling off the growth curve, then you suspect heart disease. And this, your pediatrician may help you in making a growth chart for your baby at every pediatric visit. The number 4 symptom is having a poor color. Now, color can be a blue color, what we call cyanosis, and this can be seen as bluish discoloration of skin, and the typical sites are around the mouth, inside the mouth, the tips of the earlobes, the tip of the nose, and sometimes in older children the nail beds may look very blue. So this we call cyanosis, and this happens because the deoxygenated blood, or the blood which is poor in oxygen, is mixing with the blood that's rich in oxygen and gives rise to this bluish discoloration, and this we see very commonly in what we call as a cyanotic heart disease. Now, looking at the color, apart from blueness, your child may sometimes appear very pale. So we call it pallor or a gray color, or an ashen color, and that is actually a very ominous sign. That indicates that the cardiac output, which is the amount of blood pumped out of the heart, is not adequate for that baby. So if you notice that the color is poor and not like before, then you do suspect heart disease, and typically these are the babies that will need urgent intervention. Now, the 5th symptom of heart disease is frequent chest infections. Now, these infants are having frequent chest infections, meaning they can have fever, cough, cold repeatedly, that needs a visit to the pediatrician or even hospitalization. Typically, these babies have what we call pneumonia or infection in the lung, because sometimes the heart defects have increased flow to the lungs. So there are either holes in the heart or abnormal connections that cause an increased flow to the lung, and there is a predisposition to infection. So these are one more symptom of heart disease. So to summarize, the 5 ways you can suspect that the child may be having heart disease is rapid breathing, frequent chest infections, poor feeding, poor weight gain, and blue color or ashen color. Thank you very much.